Three, two, one. You are live.
Good morning, everyone. I am Dr. Karun Singla. I am a urologist and enterologist practicing in Chandigarh. So today it's 20th September, and September being the Prostate Health Awareness Month. So today I'll be discussing a few points about prostatic problems that happen in men. So the basic aim of this Prostate Health Awareness Month, it's basically to create awareness about the problems which affect the prostate, how to deal with them, how to screen for prostate cancer, and how to educate people about the types of treatment, types of therapies available for dealing with various kinds of prostate problems. So my main focus today is going to be on benign prostatic hyperplasia, which is a non-cancerous, non-malignant condition of the prostate. So basically, what is the prostate? Prostate is a part of the male reproductive system. It is located just below the bladder, and its role is mainly for sexual function in the sense that it forms a part of the secretions which constitute the semen. Apart from that, it doesn't have any major role as far as the urinary system is concerned. So in the normal circumstances, the prostate is not obstructing. It does not compress the tube which allows the urine to pass from the bladder to the outside. But as the prostate gets enlarged, it presses upon the urethra, the tube which carries the urine from the bladder to the outside, and it obstructs the urinary flow. That is when prostate problems or the prostate symptoms, they start developing, and they cause difficulty with urination. So benign prostatic hyperplasia, which is a scientific term for a non-cancerous enlargement of the prostate. If we were to look at how common this problem is, so generally it is not seen below the age of 40, but 50% of the men above the age of 60 years will develop some prostatic symptoms. This percentage goes up to 80% once a man reaches 70 years and above. So the incidence of symptoms caused by prostate, it increases as the age advances. So if you look at this slide, the upper half shows the normal prostate, which is not compressing upon the urethra and allowing free flow of urine. On the other hand, an enlarged prostate, it will compress upon the urethra, make the tube smaller in size, and thereby hampering the urine flow. There is no exact cause as to why this enlargement of the prostate occurs with age, but it has been postulated that as men age, their testosterone increases and estrogen decreases. This abnormality in the ratio of testosterone and estrogen is what leads to the growth of the prostate gland. The various symptoms and signs of prostatic enlargement, most commonly weak urinary stream, frequent urination during the day and even during the night, dribbling after urination, a few drops of urine might leak out after finishing urination. The urge to urinate, difficulty to control the urge to urinate, leakage of urine, which can be overflow or it can be because of the inability to control the urge, and frequent urination at night. So these are the common signs and symptoms of prostatic enlargement that are encountered. So when do you see a doctor, specifically a urologist? So whenever there is symptoms which are bothersome, which are troubling you as far as your urination is concerned, I think it's a good time to go see a urologist. These symptoms, they include weak urinary stream, as I said earlier, यूरिन खुल के नहीं आना, पेशाब करने में जोर लगना, टाइम लगना, यूरिन स्टार्ट करने में टाइम लग जाना, और यूरिन रुक के आना, स्टार्टिंग एंड स्टॉपिंग, थोड़ा सा आया फिर रुक गया, फिर थोड़ा सा आया, यूरिन पास करने के बाद कुछ ड्रॉप्स यूरिन के लीक आउट हो जाना, और यूरिन का प्रेशर पड़ने पे उसको रोकना मुश्किल होना, अनकंट्रोलेबल अर्ज टू पास यूरिन. Whenever such symptoms develop, जब भी ऐसी दिक्कत हो, तो it is better that urologist से एक बार मिल लें. So, what are the risk factors for development of prostatic enlargement? Age, as I said earlier, the incidence of prostatic symptoms increases as the age advances. So, 40 years से कम पे prostate symptoms are very uncommon, but जैसे जैसे age बढ़ती है, at the age of 60, almost 50% को prostate symptoms होंगे, and after the age of 70, almost 80% have prostatic symptoms. Genetics, family में अगर किसी को prostatic symptoms हैं, prostate के symptoms है, urination problem है, तो आगे family में prostate के symptoms होने के chances ज़्यादा हैं. Hormones, testosterone और estrogen की ratio, whenever it changes, there can be prostatic enlargement and prostatic symptoms. Inflammation, prostatitis, prostate infection, all these can lead to prostatic symptoms. What are the complications of prostate enlargement? The most starking or the most difficult complication that one can encounter is a painful inability to pass urine, acute urinary retention. So इसमें there is pain, lower abdomen के अंदर pain होता है, and the person is not able to pass urine. All of a sudden एक ही दम आपको लगेगा कि यूरिन आ रहा था लेकिन अब नहीं आ रहा है, बिल्कुल जोर लगाने पे नहीं निकल पा रहा है और अंदर इकट्ठा हो गया है, बहुत दर्द हो रहा है. So it can occur spontaneously without any precedent cause, or it can be because of some medication like anti-allergy medication, alcohol intake, and it is more common in winter months. So सर्दियों के दिनों में ये problem ज़्यादा होती है. Other complication, urinary infection, यूरिन में जलन होना, यूरिन में पस आना, यूरिन में पस सेल्स आना, यूरिन कल्चर पे कोई बैक्टीरिया का ग्रोथ होना, ब्लैडर स्टोन, पेशाब की थैली के अंदर स्टोन्स बन जाना, और ब्लैडर एंड किडनी डैमेज, किडनी में स्वेलिंग आ जाना, किडनी में डैमेज होना, या फिर किडनी फंक्शन पे इफेक्ट आ जाना. सो ये कॉमन कॉम्प्लिकेशंस ऑफ प्रोस्टेट एनलार्जमेंट हैं जिनको हमें ऑन इमरजेंसी बेसिस डील करना चाहिए. So to diagnose BPH, the most common examination is a digital rectal examination. The doctor puts in a gloved finger into the rectum and examines the prostate. A very simple blood test known as a prostate specific antigen, PSA, जिसको आमतौर पे कहते हैं. It can help differentiate a benign or a non-cancerous enlargement from a cancerous enlargement. Most of the cases of prostate cancers, they have increased PSA, and this is a very good and a very sensitive marker for prostate cancer. Whenever there is a doubt for a prostate cancer, rectal ultrasound can be done to look at the prostate and to take a biopsy to get tissue for histological diagnosis of prostate cancer. The other investigations which might be done are a CT urogram or a urine analysis to rule out infection and other blood in urine, etc. A urinary flow test, commonly known as uroflowmetry, will help in measuring the flow of urine and deciding how severe or how significant the urinary obstruction is. So, coming to the treatment part, so most of the patients in today's day and age who suffer from prostate symptoms can be treated with medication. The time-tested and tried and tested medications are the alpha blockers such as tamsulosin, silodosin, or elfusicin. These help in relaxing the bladder neck muscles, and they help in improving the flow of urination, making it easier for the patient to urinate. So for an untreated patient with prostate enlargement, the enlarged prostate, the muscles around the urethra, they contract the urethra, making the urine flow difficult. On using the alpha blockers, these muscles are relaxed and the urethra enlarges or opens up, and the urine flow is made easy. The other group of medication that we commonly use are 5-alpha reductase inhibitors such as finasteride and dutasteride. These help in shrinking the prostate and also decrease the blood flow of the prostate. So these are generally indicated for patients who have a big prostate, generally more than 30 to 40 grams, and who have risk factors for complications such as urinary retention or bleeding. Most of the time, these drugs are used in combination, the alpha blockers and the 5-alpha reductase inhibitors. In patients who have coexisting sexual dysfunction in the form of erectile dysfunction, phosphodiesterase inhibitors such as tadalafil at low dose can be used to improve the prostatic symptoms. When the medications fail, when the medications are not effective, अगर medication से बिल्कुल effect नहीं आ रहा है and symptoms control नहीं हो रहे हैं, in that case, surgery can be done. In today's day and age, surgery has become very non-invasive or minimally invasive. There is no cut, there are no stitches, and most of the surgeries, most of the patient can be treated with endoscopic surgery with minimal blood loss and minimal complications. So better than treatment is the prevention. So if we were to look at the means to prevent prostatic symptoms or worsening of prostatic symptoms or prostate enlargement, diet plays a very important role. So ensure that you have 5 servings of fruits and vegetables every day. Use whole wheat flour instead of white flour. Limit consumption of red meat such as mutton, and focus more on egg, fish, poultry, or beans, which are better sources of proteins. Use healthy oils such as olive oil, nuts, avocados, and avoid saturated fats such as those present in dairy. Avoid excess sugars, चीनी का intake कम से कम रखें. Cut down on salt and watch portion size. The other thing to do is exercise. Low to moderate intensity exercise at least 4 times a day for 40 minutes each will help in improving the prostate symptoms and also decrease the chances of complication. Aerobic exercises in the form of walking and a light jog are preferable as compared to anaerobic exercises such as running or weightlifting. These exercises also benefit prostatitis as well as the sexual function. The other thing to do to prevent complications or symptoms because of prostate are to manage their fluid intake. Make sure you have adequate fluid intake, but not excessive fluid intake. Limit evening fluids. Avoid caffeinated drinks such as tea, coffee. Avoid spicy foods. Quit smoking and limit the use of alcohol. There are certain red flags which need to be watched for, such as sudden inability to pass urine associated with pain, burning or blood or passing urine, sudden severe flank pain, swelling on the feet, around the eyes, or inability to achieve or maintain an erection. All these are red flags. Whenever you experience any of them, it's better to consult a urologist at an urgent basis and get the requisite treatment. So September is the Prostate Health Awareness Month. So it is our duty to make sure that we spread the word about prostate health and help people get timely treatment and the required knowledge. So conversation needs to be started and the conversations can save lives. Let's start a conversation about men's health and let's get checked about prostate and men's health issues. Thank you.
Questions are available in chat.
Yeah, so we have a few questions from the audience. What are the long-term risks of BPH? So, as I said, there are certain complications which can happen with BPH. These can be urinary retention, which is inability to pass urine. They can be blood in urination. There can be urinary infections, which can be recurrent and which can lead to kidney damage. There can be kidney damage because of long-standing BPH. All these are the complications which are associated with long-standing BPH. It's a myth that BPH can get converted to prostate cancer, although BPH and prostate cancer can happen in the same patient. There's another question about exercises that can help with the symptoms. Yes, so like I said, mild to moderate aerobic exercises can help in improving the prostate symptoms. Also, there are a few exercises known as pelvic floor relaxation or pelvic floor muscle therapy. These are the exercises aimed at relaxing the pelvic floor, which can also improve the bladder as well as the bowel function and relieve prostate symptoms as well as constipation. The next question is drinking a lot of water good for the prostate? Adequate fluid intake is what is recommended. Excess of anything is bad. So even excess of water, especially in a single go, can lead to symptoms, worsening of symptoms, or even complications because of prostate. So it is advisable that you have adequate fluids, small amounts at frequent intervals, which is preferable. Patients who have evening symptoms should avoid excessive fluid intake in the evenings. What other problems that can affect the prostate? So apart from the BPH, the other problems that can affect the prostate are prostatitis or prostatic infection. So these are more common in younger men, less than 40, prostatitis. It can be because of infection, or it can even happen without infection. The treatment again consists of antibiotics initially, as well as some other medication to help relax the prostate. The other problem that can affect the prostate is the prostate cancer, which is commoner in elderly age group. Patients who have a family history of prostate cancer are more likely to have prostate cancer. And it is recommended that as you age, you should undergo routine screening for prostate cancer and discuss with the urologist about the risk and benefits of such screening. What are the treatment available for prostate cancer? So the treatment available for prostate cancer depends upon the stage. So as compared to, let's say, about 10 to 15 years ago, the therapy of prostate cancer has evolved. So for localized prostate cancer, that is the prostate cancer which is limited to the prostate and has not spread outside the prostate, there are surgical therapies or even radiotherapy available, which can offer almost 100% chance of cure. For prostate cancer, which is spread out of the prostate, let's say into the bones or into other distant organs, medical therapy is available. There is sequential therapy available, which has excellent results and which can help improve the quality of life as well as improve the longevity. So the treatment has undergone a revolutionary change over the last 5 to 10 years. So I think these are all the questions that we have today. So I thank you all for your patient listening, and if you have any more questions or queries, you can reach out to me on my Facebook page, or you can contact me on WhatsApp or even email. So I'll be happy to help you with any doubts or any questions that you might have. Thank you.